Canada's federal, provincial and territorial health ministers are meeting in Vancouver this weekend. Their much anticipated meeting comes as healthcare systems across the country are in what's commonly referred to as a crisis, especially faced with acute staffing shortages and burnout. For several years now, the premiers have been calling for a First Ministers' Summit with the Prime Minister to discuss increased transfer payments, and their calls haven't been answered. Instead, it will be up to the health ministers this weekend to talk. Joining me now is Stephen Staples. He's the Director of Policy and Advocacy at the Canadian Health Coalition. Stephen Staples, thanks for joining us.
Hi, Martin.
I set the scene a bit. I mean, we have had many years of promised meetings of the first ministers, and we're still awaiting that. What are you expecting this weekend out of the health ministers meeting?
Not very much, I'm afraid. This is a really low-key meeting. There has not been a lot of attention focused on it. It's not a meeting of the premiers like we saw last summer. It's a meeting of the health ministers. But we're looking for any sign that there's a thawing or any conversation between the federal government and the provincial governments to move forward on some of the critical issues that are facing our healthcare system right now. But at this point, it looks like, despite some ads being run by the premiers calling for more money from the federal government, it's going straight to voicemail. The answer is the same, not much happening.
So you don't have any great expectations for this particular meeting at a ministerial level?
I don't think so. I don't expect a lot of change coming from the standoff that we've seen. The provinces seem intent on calling for more federal transfers to cover healthcare costs. The federal government has not been signaling that they're prepared to do it. We just had a fiscal update that had very little in it in terms of attention to healthcare. The problem is the federal government wants to see some outcomes. They want to know where the money is going to go. And the province's answer has just been, butt out, write us the check, and we'll decide how to spend it. And that's the nub of the problem.
Okay, well, that brings up then something that's been much talked about since last week. The week before, Friday before last week, there was a leak to Toronto Star journalist, columnist Althea Raj. The leak from federal sources was suggesting that Ottawa might be ready to deal separately with the provinces. This is something that the premiers see as a divide and conquer strategy, but it was exactly what was done in 2016 with Justin Trudeau, Bill Morneau, and Jane Philpott when she was health minister. Do you think that's where we're going, that this is going to be an impasse, and B, it'll only be broken when the federal government starts to deal with one province at a time?
Well, it very well could be. They're definitely looking for some kind of strategy. I think the days of big health accords may be behind us. The future could be bilateral discussions like we saw in childcare with the federal government going from province to province to make deals. There's another possibility, too. The dental benefit that was negotiated at the behest of the NDP is that program is going ahead without the provinces at all. That's just going to be a federal insurance program to cover for dental care. Now, coming down the pipe, Martin, is pharmacare. That's also promised under the deal. That's going to be tougher to do without cooperation from the provinces. But what we're hearing is there are some provinces that are probably willing to go ahead with a new pharmacare program. Mm-hmm. Others are not. So the federal government could be setting the stage for individual negotiations with those provinces that are willing to put some strings attached to the funding and deliver better outcomes and programs for Canadians.
Okay, Stephen Staples, thank you very much. We will keep in contact and we will watch this, obviously, on a topic which is so important and so close to most Canadians' hearts. Thanks a lot.
Nice to be here.